I think we need to talk about healthcare a little bit. You know, a lot of people are advocating for Medicare for all, and I think that's a good plan. It's a good direction to take. But man, it will take years to get it running up and smooth, you know, to where there aren't any complaints. There's going to be bumps in the road, and there's going to be a tremendous amount of administrative details that are going to have to be worked out, but it's the direction that we need to go in. For example, every procedure that's done, everything that's provided by healthcare providers is going to be individually broken down, and there's going to have to be a price on each and every one of these procedures. And not only that, it's going to vary from region to region, because the guy who works in downtown Manhattan has to be compensated at a higher level than the guy who's working in rural Arkansas or Kentucky. That's just the reality of the situation. So that's an administrative nightmare. And what do you do with processing? Well, in terms of processing claims, you do what Medicare is doing now. You hire private insurance companies to process the claims. They're very, very effective at that. However, they should not be involved in the clinical decision making, which is where they're interjecting themselves now. That's one of the complaints I hear about a government system. You don't want your government in between you and your doctor. Well, I would rather have some indifferent bureaucrat in between me and my doctor than an insurance personnel who's got a profit motive, because they're not going to want to pay money out. The bureaucrat isn't going to care. I mean, that's not to say that the money is just going to flow freely and anybody can grab out of the big grab bag. There's going to have to be restrictions. There's going to have to be regulations where you can determine, is somebody abusing the system? It's highly doubtful that patients are going to abuse the system. I mean, do people go to the doctor for fun? That's a ridiculous thought. But there will be a temptation for providers. So there has to be, all of the procedures have to be scheduled, and there has to be benchmarks as to how much an individual provider or an individual hospital is going to be billing. You have to have an understanding of what's a rational amount of money that these people are going to be billing for. And a red flag has got to go up if it gets beyond that benchmark. But all in all, the way to go is Medicare for all. And it's not going to be insurance. Don't even think about it as insurance. Think about it as a group purchasing plan. And whenever you have something like that where, I mean, why do you think fleet prices are cheaper than what you and I can pay when we go to buy an automobile? It's because there's a guaranteed market there. Well, there's a guaranteed market for providers then too. So you're going to have to take a little bit less in return for the insurance. Well, there's that word again. In return for the assurance that you're going to have customers and buyers, patients. So, all in all, Medicare for all is the way to go. But we have to realize it's going to take a while to implement. There's going to be bumps along the road, and don't get all panicky like happened with Obamacare. And oh my God, you know, there's a guy over in West Texas that's got a hangnail, and it's not being taken care of. This socialistic medicine is no good. So everybody's complaining about it every time there's a little bit of a glitch in the system. But I'll tell you what, if we went to Medicare for all on the very first day of implementing it, the very first day, it would be better than what we have. So you take the improvements and you improve on the improvements, and you work your way through the difficulties, and eventually you'll have a good working system that's going to provide health care for nearly everyone in the country at a much less expensive rate, and there's going to be a lot more security for the providers. So that's my feelings on health care.